Hi, I'm Dr. Anthony Levinson, and this is my colleague, Dr. Richard Sztramko. And together we're really excited to bring you our 12th live event. And today's topic is on stigma and dementia. Really sorry about the 10-minute delay. We had a scheduling issue with the live feed, but we're up and running now, and we're really excited to chat about this challenging topic. We're already getting some good comments coming in, so I'll remind you, you can submit your questions through Facebook or through the chat bot on the iGeriCare.ca live events page. We'll try and stick to our original plan to finish up at 1:45, or at least the original finishing time. And please feel free to send in your Q&A. As we've talked about before, there's over 500,000 people with dementia, and so many people, over 1 million, affected by the disease. And stigma, people often feel stigmatized, excluded, treated differently. Caregivers, everybody has their own separate journey, but I think this is something we see a lot in the geriatrics clinic, in the hospitals, in the neuropsychiatry clinic. So we're hoping that through this topic and the discussion and brainstorming that we can contribute to the dialogue to raise awareness and through education to make more dementia-friendly communities and improve the lives of caregivers. So why don't we kickstart it a little bit before we go to some of the questions to talk a little bit about what is stigma in dementia, and what can you just comment a little bit on that? What do you see from your perspective?
So stigma is usually the negative associations that happen as a result of getting a label. So for instance, things can be projected onto people that have a label. So it might be stereotypes, misunderstandings, or misinformation that people have about a disease, let's say dementia, that after a patient receives a diagnosis, people start thinking about them differently automatically. So instead of understanding the complex nature of life and all the things that that person may be experiencing or feeling or needing or requiring, desiring, they just think about them simply as a label and have knee-jerk reactions or thoughts about that. So that's kind of one way that it happens, things that get projected onto people that have a diagnosis. The other thing is the subjective experience of the patient or of a caregiver that receive a diagnosis of dementia. It makes them automatically feel certain ways or feel that they're less worthy, less deserving of love, less able to do things, less able to enjoy their life. And anytime that there's an automatic knee-jerk reflex, we take issue with that because there is so much to life that can still be enjoyed. There's a lot of happiness that can be found in different moments. Things might be experienced in different ways, but it's important to know that just because you receive that label, you need to have some flexibility and understanding the different opportunities that are still
I feel like there's
possible.
There's more and more people living longer with a diagnosis of dementia, and can live well with a diagnosis of dementia. But it's almost like how cancer was 30 years ago, when it was all hush hush. You sort of had the big C. People were not interested in learning about what are the different types of cancers, or what are the interventions, or how are you managing. And it's almost the same sometimes with dementia. It's sort of a don't ask, don't tell attitude, even though there are many people living with dementia, and more as the population ages. I think the other thing that we see a little bit in the clinic, and also seems to happen, like some of the stats worldwide are interesting, where less than 1 in 4 people with dementia actually receives a diagnosis. And I feel like this is another issue related to even the healthcare community and stigma, that there's, you might have a conversation almost like with the caregiver, and you're speaking to the caregiver rather than the person with dementia.
Right.
And there may not even be a positive diagnosis voiced to the patient, but it's sort of like, well, we all know that there's dementia going on. And I feel like that's another manifestation of stigma to some degree.
I think you're right. It's trying to find the difficult balance point too as well between using specific medical language and understanding what's happening with the disease, while at the same time understanding that the disease fits in to somebody's life that is a rich narrative as well, that has so much else going on. And people don't experience a word, they don't experience being labeled a disease, they just experience how that impacts their day-to-day life and how that might need to be adjusted. The other
Yeah, I think, and some of that definitely relates to language, and we're going to talk a little bit about language as well. I think where we see stigma, sometimes people using the term demented or senile or crazy. These are some of the ways that I think there's so much room for improvement now, in terms of, this is a person living with dementia. This is not, a demented person. And we see this, the way the language has evolved as well. Like, instead of referring to people as their disease, a diabetic or a schizophrenic, we talk about a person living with diabetes. So that's one of the ways that I think it's really important that we change the way that we speak about dementia and the language that we use. One of the things that's interesting, we had an awareness study, a survey that was done by the Alzheimer's Society back in 2017. And what you can see from this is that many Canadians are very uncomfortable about dementia. Almost half would not feel comfortable disclosing dementia to a family member. And then you have, 55% wouldn't feel comfortable disclosing to friends. In the case of an early onset dementia where somebody's still working, 67%, 2/3 would feel uncomfortable talking with coworkers. So, people are terrified of the disease and the diagnosis, and most people don't think they can live well with dementia. They feel like, their life, 27% feel that their life would be over if they had a dementia. And I think all of these misunderstandings about the illness kind of contribute to these thoughts, and that sort of translates into stigma or not wanting to become educated or talk about the issue. 1 in 5 said, I'm going to avoid seeking help as long as possible, really a strategy of avoidance. And, what we've tried to do with iGeriCare is, educate caregivers. The importance of getting early diagnosis, of getting supports is so critical. And if the stigma causes people to avoid that, if the stigma contributes to underdiagnosis, it's really hard for people to access the supports and resources in the community that could really help their lives as caregivers.
No, that makes a lot of sense. And, we had an example of a woman in the clinic the other day, and she'd had mild cognitive impairment for some time and some depression, and over time developed mild dementia. And she was still quite active and was going to have, play card games with her friends and was going out shopping. And it became a bit problematic because her memory problems were noticed by her friends, but she didn't feel comfortable disclosing the diagnosis that she was having. And so her friends, not understanding that she wasn't being dramatic or wasn't trying to cause problems, but had memory issues related to Alzheimer's disease, kind of started to pull back from her. And so it was one of those situations where the patient didn't necessarily feel comfortable talking about the diagnosis because she felt bad, and she didn't want to tell her friends about what she was suffering from, while at the same time there was a potential for education in that situation, potentially including her friends in what her life experience is now.
They may have been a lot more accepting and inclusive if she had been forthcoming. It's almost like a self stigma, and that contributes to that.
And no way are we ever suggesting that would be an easy thing to do.
Yeah.
That would be an extremely challenging thing to do, to discuss this with your friends. And it's not easy to do in society as well right now, because we're talking about all of these statistics around just how stigmatized people feel or the illness is. And we need to start saying, hey, this is a disease where there are so many people that have it and are struggling with it. We really need to come together, I think, as communities to be accepting of people that are struggling with this illness and build out positive experiences for them. And hopefully, as the understanding of Alzheimer's disease improves, or all dementias improve, people will feel less hesitant to talk about what they're struggling with especially their family and their friends.
I think we're seeing, shifts with other stigmatized conditions, and many of them occur in my area of mental health or psychiatry. And I think over the last decade, there's been some progress in coming out of the shadows with respect to certain conditions like depression. I hope that the same thing happens over time with dementia, but I think it's going to take multiple different types of interventions to change some of these deeply rooted fears and ideas about it. So
absolutely,
I think we'll jump back and forth, assuming we have some questions, and then we'll sort of come back to ways in which stigma contributes to the burden, and then we'll maybe talk a little bit more about dementia-friendly communities and what people can do. So we had a comment from Ottawa, a question. Could sensitive, well-planned interventions support the patient and the family struggling to have the patient somewhat socially involved and therefore reduce the self-stigma of the patient? Any thoughts about that?
I think it's a great question. And I love the fact that they used the language sensitive and well-planned. I would probably add to that patient-centered, meaning all of us are different, and patients that have dementia are quite different also. So understanding what their specific needs are. If you're a 90-year-old older Italian male versus a 56-year-old Punjabi-speaking female, you're going to have different needs. And so the planned sensitive interventions should take that into consideration. One thing to consider would be a family-based intervention. So let's say somebody's feeling socially isolated from their family. They don't feel like talking about that. Planning a discussion with family members to discuss how everybody's feeling and what can be done about it, or planning certain outings that are accessible to the person that has dementia, but also an outing that doesn't overwhelm them or overwhelm their cognitive capacity. So I think that's a good intervention. We've discussed day programs before. They're not perfect and they're not for everybody, but certainly if you go to a day program at a community center and you see other people that are struggling with cognitive impairment, but you're able to have meaningful interaction with people, you're able to experience joyful experiences, you're able to get some exercise. I think you'll find people start coming out of their shell when they realize, hey, I'm not alone in my struggles, and I'm still engaging in activities that I can find pleasure in and I can get out of the house. Then they start to feel like the label of the diagnosis dementia isn't limiting them as much as it had previously. And some of the negative emotional association with the diagnosis can then also be limited. So it's a great question.
Yeah, and I think
sensitive, well-planned, patient-centered interventions.
I like the idea of the patient and the family, and whether the intervention includes both the caregiver and the person with dementia, or if it is a social interaction for the person with dementia, it actually gives the caregiver and the family a bit of respite as well, which is so important. So I think there's ways in which stigma contribute to the social isolation of both the person with dementia, but also the family and the caregiver. So these kinds of interventions, I think, hold out great potential to help with that aspect of things.
I think you're right. And to take that just kind of one step further is the embarrassment or the stigma that the caregiver does feel, right? You're a unit. You potentially have been a unit, a social unit for a very long time. You go to dinners together. You go to parties. So when your loved one is experiencing these problems, it also causes you discomfort as well, and may cause you to want to isolate, and
Yeah.
that happens quite frequently. So you're right. If both people are understanding, and potentially the caregiver might be an advocate in those situations, and the more comfortable you feel with um, dealing with what your life looks like outside of the label, the more comfortable everybody around you feels, and the more confidently you can understand what's happening and explain it to the other people that are around you in your social setting. Oftentimes, the more comfortable and less, the more comfortable everybody else will feel. It's not about making people feel comfortable. Obviously, it's not your job if you're suffering with these to make everything right for everybody else. But if you do want to improve the quality of your life, sometimes a bit of education and kind of self-confidence is warranted.
Mm-hmm. The another question that came in is, how can I get my mom's physician to speak to her when we're at appointments rather than me? And I'm going to say this is something that we see not infrequently. Either the caregiver interrupts the person with dementia or does all the talking for them, or the actual clinician or physician or trainee sort of addresses their comments to the caregiver and kind of bypasses the person with dementia.
Yeah. I think there's a few things. If you notice that it's been happening quite frequently, the best time to bring it up is probably not right in the meeting. It can cause some tension. But you could talk to the physician afterwards, leave them a message or call them and say, I feel uncomfortable if you're not talking to the person that I'm caring for, because they have dignity, they require respect, and they need to be communicated to as well. It's very dependent on the stage of dementia as well. And so I don't know if you struggle with this, but I'll struggle with it as well. There is sometimes a lot of complicated information that you need to get through, talking about medications, side effects, risks and benefits. And somebody that has moderate to severe cognitive impairment will have a very difficult time keeping up with all of that information. So my strategy in that situation is to talk to them first about other issues. How are you feeling? Can I do anything for you? What's your biggest need or your biggest concern right now? Is there any possibility to have any humor interjected into just a usual personal experience before you get into dealing with all of this complex information? And sometimes that makes them feel like they're the most important person in the room, which is extremely important. And then you'll deal with the more technical issues afterwards.
A couple of other tips or strategies that I will sometimes recommend to people. One is just to not answer the question when it's directed to you, and actually do the sort of Tai Chi move to redirect it to the person with dementia to answer the question. The other thing is to come prepared as the caregiver with certain things in writing, whether it's the list of medicines or how things have been doing recently. So it's like, some of those questions that you need answers to, here's a summary of, activities lately or medical conditions or side effects, so that more time in the encounter can be spent between the clinician and the person with dementia while the physician still gets some of their questions answered. So we'll go back to some other questions or comments in a bit, but I wanted you to talk a little bit about, we've talked a bit about how some of the stigma may impact the caregivers and maybe even self-stigma. What are some of the other ways that you've seen stigma kind of add to the burden of dementia?
Well, I mean, the first thing you commented on previously in the stats are people not even receiving a diagnosis of dementia. So if there are memory problems or concerns, people may be scared of receiving a label in the first place, and so they won't get assessed by a clinician. And as we've talked about before, there are reversible causes of dementia. Yeah. So you might be missing out on getting assessed for a thyroid problem or vitamin deficiency or something that's reversible. Also, cognitive problems can be associated with other medical illnesses and may cause you to miss out on receiving those things.
And there are other issues too, like right now, and we've said maybe we'll talk about it at another live event. But if you receive a diagnosis, you may have the opportunity to participate in clinical trials, for example.
Absolutely.
But if you do not receive a diagnosis, then how you wouldn't even be eligible to participate in a trial.
The other thing is, if you receive that diagnosis, there are a lot of bad things which we're talking about with the stigma, but if you understand what you're dealing with, then you can get connected with all of the community supports that may help you to benefit. So if there are any changes that you need to your house, or you're unable to drive, and you can get darts to get you around your community a little bit better. You will get educational resources so that you understand what you're dealing with. You get connected with the Alzheimer's Society and First Link. There's so many other benefits.
We've talked a little bit too about understanding and planning around decision making. So we talked about advanced care planning and making financial plans. So receiving a diagnosis in a timely manner when the person with dementia is capable of participating in a lot of those plans, really empowers the person and their family to come up with some of not just financial planning, but decision making around future healthcare and being able to articulate their wishes and preferences with respect to management that might be more challenging for them to make decisions in the future. So.
It's tough to, when everybody's dealing with an elephant in the room on a daily basis for long periods of time. So if you know that there are memory problems and your family is aware that there are memory problems, it definitely causes a lot of stress if it's not addressed in a direct fashion for people. And so sometimes getting over that hump and putting everybody onto the same kind of level playing field and having everything out in the open is good for everybody, and people will find a sense of relief. So it's kind of the last benefit, is just not kind of flying with blinders on, but knowing exactly what you're dealing with, and then being able to make a plan.
I feel like if there, and this is obviously one of our important rationales for the iGeriCare educational content, that the knowledge is beneficial for the caregiver in a number of respects. But one of the ones that if you don't have a diagnosis and you don't know, there may be more of a tendency for the family to blame themselves or blame their loved one.
Yeah.
So, we've talked about that in relation to some of the symptoms like apathy, where somebody's, not engaged, and the caregiver's, getting angry at the person with dementia for something that is, beyond their control. So I think that's another element where if the family and the caregiver can become more educated, they may be less likely to, ascribe behaviors or moods and blame the person with dementia for some of the symptoms of the illness.
Mm-hmm.
So I guess in terms of, now we've understood some of the impacts of stigma, what are some of the things that caregivers can do? We've spoken a little bit because of that great question from Ottawa about some strategies, but what are some of the other things that you recommend for caregivers?
So I think getting clarity and getting educated, and then when you understand a bit better what's happening, you can speak more openly and confidently about the day-to-day issues that you're dealing with. When you can feel confident enough that you can explain what's happening, then that means you could also educate people around you. So if you understand that the person with dementia is struggling because of these issues, but other members of the family are still frustrated and upset and playing the blame game, then you can educate them, provide them with resources to understand a bit better. And similarly, if you're in the social settings that we were describing previously, potentially you're educating friends, and then everybody can potentially alter the activities that people are getting up to, or modify them slightly to have a more inclusive, welcoming environment.
And I think, there's obviously no guarantees and you can't necessarily control everybody's attitudes, because we think in general it's better to be open. For sure, in some cases, you may encounter people when the diagnosis is explained to them. They may not be understanding, but I think on balance, it does help to have that communication, and does help people to be more accepting and understanding. And but obviously you can't always control other people's attitudes and behavior. There may be people that will isolate you regardless. I think in that sense, don't be discouraged. Make efforts to overcome the stigma, but use it as that education opportunity, use it as an opportunity to get understanding and engage and not lose some of those social connections. But, don't be discouraged if you do encounter people with, prejudice, or because of the stigma that they are not accepting, or they can't tolerate the idea, or they're just too uncomfortable.
And then I think you kind of graduate through the different stages from the most immediate sphere of influence that you have being yourself and your loved one and your immediate family, getting out a little bit larger to your immediate friends that you're interacting with, an immediate community. And then some people feel comfortable and confident enough with the information that they gain to actually become an advocate on a societal level for policy change, to increase funds for research, to help with fundraising. And it's been remarkable to me, showing up to various different events and seeing high-level scientific researchers and large organizations such as the Alzheimer's Society, but seeing featured at these large events patients that have dementia, that are advocating for themselves, that are showing up and saying, if you're out there and you have dementia, you're not alone. We're here to support. It's pretty remarkable. And then also seeing the caregivers that are involved in that sense as well. It's pretty special stuff.
And I think one of the things that, we have a national dementia strategy in various provinces now. There's initiatives and quality standards and provincial strategies. And I think one of the things that's been identified is in order for people with dementia, to reduce stigma, in order for caregivers to sort of come out of the shadows, one of the first things that is so important is to try to reduce stigma, to have these conversations and advocate. And I want to give a shout out to the Champlain Dementia Network in Ottawa, who are doing some great work to try to raise awareness around dementia-friendly communities. And that's another way in which people can advocate. Do you want to say a little bit about that concept around dementia-friendly communities and what that looks like?
Sure. I think it's situations where people have received enough education on what dementia is, and that perhaps it's the community organization's understanding. So there are advocacy groups, but potentially it's the police, the EHS, it's the setup of how the roadways or walkways are constructed. It's the support or ancillary kind of technologies that may be implemented as well. There's a lot of different things, but maybe you can speak specifically to what's happening with the Champlain Network.
I think it's not one thing, just as you alluded to. It's raising awareness and the education levels so that even shopkeepers or people on the street are treating those with dementia with more respect and understanding, and I think raising the bar more generally as a society. So they've done some really nice work and have some nice resources on the Champlain Dementia Network site, and I think that's something we're going to see more and more of as hopefully things become less stigmatized. More and more people talk about it, and there's very practical things. I mean, what happens if somebody comes into your shop and you're a shopkeeper, or in the healthcare system? Right. How do we reduce some of those barriers and offer accessible care regardless of people's cognitive status?
Or you see somebody wandering down the street confused and looking lost, what to do, as opposed to thinking that there's something just wrong with them and judging them. It's how do I come alongside this person and help them get to where they need to get to?
And one of the things that we talked a little bit about, and there was another story from somebody about just the language we use, and I think people even, I think we talked a bit about, sometimes clinicians now use the term major neurocognitive disorder instead of dementia, or people will talk about the specific cause, the specific disease like Alzheimer's disease. Those are some of the ways that I think people are trying to take a shortcut around the stigma that's associated with the word dementia. But I think it's actually more of those dementia-friendly community thing, whatever the word that's used. It's about raising our understanding and using appropriate, sensitive language as well.
I think it's pretty impressive too. So there's kind of dementia friendly communities that will exist in the greater world, and then these dementia-friendly villages that are also being constructed that are designed only for people that have the memory problems, and will have supportive features and memory features built into them so that they're safe. I think those are pretty interesting evolutions in terms of dementia communities as well.
We've got some other really good questions coming through. There's a question from Vancouver. I find it hard to balance my partner's wish to not let too many people know and reluctance to ask for help when I know many friends would be happy to help. So this is a challenging one where the caregiver is looking for more supports and wants to sort of destigmatize and have the communication, but the person with dementia is reluctant. I'm going to say there's absolutely no easy answer, and it is really important to respect the autonomy of the person with dementia. I think where it is maybe starts is having the conversation about what the needs are for you, the caregiver. That you actually, it's not for them, that it's for you, that you need more supports, and maybe start with trying to be able to engage like maybe one of your closest friends or a very close family member, so that the person with dementia may become a little more comfortable with that idea. But I think this is a very challenging one. We've talked about this before, where sometimes the person with dementia doesn't want the supports, and sometimes the caregiver is reluctant.
I wonder too, if the person with dementia doesn't want to let their friends or family know because they're embarrassed about that, but potentially if the caregiver could go to a support group that was a little bit more anonymous, whether that might help as well, potentially making new connections. It's never as easy as talking with somebody that you already know or that you're already comfortable with, but you'd also be surprised at how quickly bonds can form in some of these support groups when people are dealing with such challenging issues to the same degree. So that might be an alternative strategy.
But I would say, try to find a person that is maybe the most trusted of the person with dementia to see if that can open the door.
Yeah.
Another good question, Thunder Bay, are there any education sessions that are offered to primary grade students to better understand the disease that could be affecting parents or grandparents? I think the Alzheimer's Society has a children's book that is geared towards that. I'm not aware of any actual education sessions or sort of face-to-face or in-person. It's probably worth checking your local Alzheimer's Society chapter to see if they do offer that, but I'm not aware of that. But I do know there are some very good children's books, both in the US, and I think there's a Canadian one that's sort of geared towards younger children understanding what might be going on with a grandparent. Great question. Another question, please comment on why we're expecting to see increasing incidence of dementia. I don't know if you want to take that one.
Right. This is really complicated. So I'm not specifically an epidemiologist, but the incidence is the number of new cases that are happening every year. And so for a long time, the absolute number of new diagnoses was increasing over time. But it seems like the incidence might be stabilizing.
It's about 20,000 new diagnoses per year. And I think the function of what we call prevalence is like how many people total rather than new ones. That is increasing because of the aging population.
Absolutely.
So, all right. So I really want to thank everybody for joining us. I'm sorry we've had a slightly shortened session due to our scheduling issue, but really appreciate your contributions. And we've also had people comment on how much they appreciate the sessions
Mm-hmm.
and the iGeriCare.ca site. Just to let people know, we will post the recording of today's live event as well. So you can always direct friends, family to iGeriCare.ca/events to watch any of the live events. And iGeriCare would not have been possible without the support from the Center for Aging and Brain Health Innovation, or CABI, powered by Baycrest, the Geris Center at Hamilton Health Sciences, McMaster University, the Hamilton Health Sciences Foundation, the Alzheimer's Society Foundation of Hamilton, Halton, and Brantford, and our Division of E-Learning Innovation. And thank our friends at the McPherson Institute here at McMaster for loaning us the studio. There is a survey pinned at the top of the comments section. We really appreciate your feedback, and let us know what topics you would like to see in future live events. Our next live event, Thursday, November 21st. And once again, teamwork makes the dream work. I want to thank Jamie, Mike, Stephanie for helping things go smoothly, and Jody remotely fielding questions. And we'll see you again in a month.